I'm joined now by Dr. Raj Panjabi, Senior Director of the National Security Council, leading the White House's pandemic office. And Doctor, help me triangulate this a little bit. The president raised the alarm about monkeypox, then he softened his statements a little bit this morning. What's the reality of this outbreak, and just how worried should Americans be about it?
Thank you, Garrett, and thanks for having me on. The president is really ensuring we stay vigilant. We've taken infectious diseases seriously from the beginning of this administration. On day one, the president restored the Pandemic Preparedness Office that I lead now, and we are monitoring and responding to infectious disease threats, including this one. When it comes to risk to the general public, we know that risk is low, and that's because the current number of cases, all of the cases we've seen so far, all have been less severe. And we know that we have, as the president said, vaccines available for this disease. It's not a new disease. It's spreading in new ways, in new places, and quite suddenly. But we have vaccines and we have treatments.
Can you talk about that spread a little bit? I think that's one of the things that people have the most questions about. You're somebody who's got firsthand experience treating this disease. How does it spread? How contagious is it? Or do we know with this current outbreak?
So the disease presents with flu-like symptoms in most patients, and a rash can develop. It usually resolves in 2 to 4 weeks. It's direct contact with the rash, the skin lesions themselves, that is the most normal way or major way that this transmits from people to people, and that's what we worry about. So this is not asymptomatic transmission as we saw with COVID, and it's also not as contagious as COVID is. You have to have contact directly with a person who has the symptoms, and as you can imagine, the pictures you're showing now, the rash itself is quite apparent.
You're the pandemic preparedness guy. We have a plan for this. What does a plan for a U.S. response look like should this become worse?
Yeah, there are a few things we're doing immediately. As soon as we knew there were new cases reported first in the UK a few weeks ago, we had already mobilized our colleagues at the departments and agencies, the CDC, Department of Health and Human Services, to start to work to procure sufficient amounts of vaccines and treatments. So that's number one. Number two, we're working with state and local actors. I was just in touch with the doctors at the hospital in Boston this weekend to ensure that they have the testing capability available, and also that they have the guidance of how to use the vaccine for those providers who are at the highest risk. And I'm happy to report that as of yesterday, they already have the vaccine available and are offering it to the healthcare providers who were exposed to the first patient. So that's what we have to do, Garrett, with this. It's science-based. To stop and end this outbreak, we've got to find those infected, ensure they get isolated and have the treatment and care that they need, and then ensure that those who are exposed get the vaccines they need. If we do that again and again, that's what makes possible ending this outbreak, and that's what's worked before. We had an outbreak in 2003, and the same approach of ensuring we're identifying and supporting patients, that we're tracing their contacts, enlisting those who've been exposed, and making sure we're monitoring them. That's what brought the 2003 outbreak in this country under control.
This is effectively the smallpox vaccine that we use, right? Is there any reason to think that for younger folks who weren't vaccinated against smallpox, this could be more serious, older folks less so? I mean, talk to me about the kind of relation to smallpox here and what people should know about that.
Yeah, so think of monkeypox as in the same family of viruses as smallpox, but a much less severe type of disease. So smallpox had a higher mortality rate. This disease has a death rate of less than 1%, and that's in countries with weaker healthcare systems. I worked in Liberia before this, as you were mentioning, and we didn't have access to vaccines there. We have access to vaccines and treatments here, and that makes the risk substantially lower. The vaccine you mentioned, smallpox vaccine, is one type of vaccine that's available for dealing with monkeypox. There's also a vaccine that's been licensed for both smallpox and monkeypox. That's called Jynneos, and that is quite effective, especially when given within 4 days of an exposure to a patient with monkeypox.
Doc, I would be remiss not to ask you about COVID while I have you here. We're 2 years on now, and I'm just curious if you worry about the distrust. You talked about the science earlier, the distrust that some people have for the medical community during the pandemic. If it makes it harder for you guys as you're trying to kind of keep battling with COVID now, while with the other hand, potentially worried about this other disease as well.
Well, on the one hand, it's made people a lot more aware of infectious diseases, and even the conversation we're having now is about how the virus transmits. who can get most sick, how many deaths it causes. Some way the public's very aware. Of course, with that awareness comes anxiety and fear, and I think the approach of this administration is science-based, empathy-based, and transparency-based. We have already, as I mentioned, started to work with local, state, and international health officials to make sure vaccines and treatments are available to patients, that we have testing available so we identify more cases. The CDC's put out an alert on Friday already to all doctors in the country to ensure that we're finding cases and reporting them. And of course, we're working with international partners to figure out the source of this outbreak and so we can try to stop it. You know, we will continue to remain engaged transparently with the public. And we want you to know that if you're worried about this and you are afraid you have symptoms, reach out to your providers. We do have solutions for this. This is not like COVID, where it took some time before we had countermeasures, vaccines, and treatments. We have that now for this disease.
Great. Dr. Raj Panjabi, thank you for coming on and sharing your expertise with us.